So I'm Cameron. I'm one of the fellows. Got finishing up the year. So this is kind of one last presentation for everyone here. A little different than some of the other specifically spine-focused ones we've done, and I'll explain the reasoning behind that and kind of everything there. But the goals of this is to understand and define burnout, understand the role and effect it has on physicians and surgeons, and learn ways to avoid and cope with burnout. It's funny coming off this talk. Originally, I started with the idea of doing a kind of early success tips for physicians in like early practice, and specifically spine surgeons. And then slowly, as I was looking into that more and more, the more I looked into it, the more it kind of pointed a lot of these things that we'll talk about today. And then coming on the kind of tail of this conference we just had this past weekend with Bridging the Gap, it's kind of funny how similar a lot of these and topics that I'll touch on were discussed over the weekend via the various people that spoke. So it kind of even some of the articles I think were the same kind of that I already had in here were quoted by some of the physicians this weekend. Then another reason why I did this, this is Dr. Drew Kelly. He was one of my attendings at OU and one of my kind of mentors and a good friend actually. And he unfortunately took his own life while I was still training there. And so this topic became more and more prevalent and important to me then. And now the focus is shifting on this topic overall in the kind of spine world, medical world, everywhere else. So now when you go on PubMed and you look up articles, burnout and wellness weren't really topics 20 years ago that were really published about. And now when you go on PubMed, this shows the number of publications regarding these topics now. Wellness, you can see, is kind of not as prevalent, but burnout, I mean, it's just unbelievable the amount of articles and topics that talk about this. And so we'll try to kind of succinctly talk about that. So if we want to learn about it, we kind of have to have a good definition for it. But unfortunately, when you talk about burnout, looking through all these articles and kind of some meta-analyses of these, there's over 140 definitions of burnout with no clear consensus over the true meaning or criteria to define this. But a lot of them kind of break it down into three separate categories, so we'll kind of focus on that. The first one will be exhaustion. It reflects the feeling of being overextended and depleted of physical and emotional resources. This can lead to emotional cognitive distance from one's work and can be a sign of work overload. Next one, cynicism. So previously, a lot of the articles, when you look at, you refer to this either as cynicism or depersonalization. So it's a negative, callous, or detached response to elements of one's work. So this presents as things such as irritability, constant negative feeling towards patients and colleagues, loss of idealism, and even withdrawal from work, from family, from friends, from everything. And then inefficacy is the kind of last portion of this definition of burnout, and this captures the feelings of incompetence and a lack of productivity and inability to cope with everyday situations and decrease achievement in work. And those are kind of the three pillars, the three standardized kind of pathways when people are talking about burnout that they try to go down and how to treat it. And so if we want to talk about burnout, we talk about kind of the opposite, and what it ultimately, a lot of these articles come down to something that is along the lines of engagement. So it's an energetic state of involvement with personally fulfilling activities that enhance one's sense of professional efficacy. And so through engagement, why I like this kind of definition or as a response to burnout is because it can lead to alleviating one's burnout because it changes exhaustion to energy, cynicism to involvement, and efficacy to efficacy. So those are the goals of kind of why we approach this and why we talk about these things, because we want to turn these negatives into positives and kind of turn this around. So we'll start with a more general look and then zoom in on kind of orthopedics and spine as a whole. But in a 2017 survey of 14,000 physicians, it showed that overall self-reported burnout rate was 51%, which was up from a previous survey of 40% in 2013. Male physicians commit suicide about 1.4 times the rate of general population, and female physicians about 2.3 times. Burnout as a whole reduces patient access to physicians because nearly 20% report an intent to reduce their clinical hours in the next year. About 2% intend to leave medicine for a different career in the next 2 years. And kind of talking about some of the things that we talked about this past weekend was the labor shortage and how it's going to be hard to meet that demand. So if we have more physicians with burnout, then we're definitely not going to be able to reach that demand and treat patients effectively and efficiently. And ultimately, our goal as physicians is to help patients and treat patients, as well as making sure our own health is kind of there and allows us to do this. So that kind of shows how important this is. And then burnout impacts patient safety, like we just talked about. And so we don't want to commit medical errors because we're burnt out. We don't want to provide lower quality of care because that just sends you down a downward spiral that burnout initiates, and then it's you spiral down it and it's hard to bounce back. But and then there's different ways of doing this. We won't go too deep into the actual measurement tools, but there's different things such as the Maslach burnout inventory and different kind of questionnaires that is how these surveys come up with burnout rates and things like that. And so these kind of break things down into workload, control, reward, community, fairness, and values. And that's kind of the 6 kind of standardized areas that they like to talk about. And then kind of talking about how this affects physicians. So when stress becomes intolerable, pleasure disappears and values are compromised, and so that paves the way for burnout. And ultimately, this leads to an identity crisis for physicians because we all hopefully come into this field with certain values that we want to uphold, but when those become compromised, then you're set down the wrong path. And so when your feelings of personal accomplishment are blunted and disrupted, then all other levels of this pyramid on the right kind of go to waste, and you start compromising things that you didn't used to do. So you start at the top of the pyramid, and that's kind of self-fulfillment needs. But as soon as those start getting compromised, it sends you down a path where you start, belongingness and love needs, those get compromised. So your intimate relationships and relationship with your wife and your friends, safety needs, and then ultimately even the most basic physiological needs, food, water, warmth, rest. And so that those all become compromised, and that's why this is such a bad issue. This was an article from or a topic discussed at POSNA, and this is one of the articles that they talked about. And so when they interviewed the POSNA members, which a lot of people think pediatric orthopedic surgeons, pretty happy group as a whole, but even within this group, they found that 27% essentially definitely feeling burned out and have one or more symptoms of burnout, such as physical and emotional exhaustion, and then about 10% have even worse symptoms, and 4% or 3.5% feel completely burned out and wonder if they can go on, question their kind of position in the field. And so then these are risk factors, and we'll kind of talk about these more in depth when we talk about how we can approach this and attack this. But things that have been looked at and found to affect this: hours worked per week, finding meaning in your work, taking a positive outlook, incorporating philosophy of stressing work-life balance. Those are all things that help, but other things are negative. And so, and then once again, same thing here. These are independent factors and the odds ratios, but we'll kind of talk more about those as we go on. But now, more specifically in orthopedic surgeons, you'll find rates anywhere from about 30% to about 60% regarding rates of burnout in orthopedic surgeons, and these are all fairly recent studies. And then another recent study, not necessarily burnout in the true definition, but 67% of orthopedic surgeons in this survey noted that stress at work significantly impacted their personal life. So, although that's not the true definition of burnout, it is the start of something that could set you down a bad path. And then 31% of orthopedic surgeons, they rated their stress level at more than 8 out of 10, and 40% deemed this current stress level unacceptable. So extremely high stress kind of field that we work in, and we are all cognizant of that. Whether we address it or not is the problem. So And then a lot of the times when you look at these, administrative meddling and the regulatory burden are set to be the most difficult to tolerate. Whereas on the flip side, orthopedic surgeons in some of these studies noted that they feel the best when they're operating, because you can disconnect from everything and you can just operate. But operating brings along its own issues and problems, and we'll talk about those here in a second. And then a staggering and kind of alarming fact: orthopedic surgeons have the highest prevalence of death by suicide among all surgical subspecialties. And from 2003 to 2017, orthopedic surgeons comprised 28.2% of surgeon suicides. This is just a table showing the different studies that kind of looked at those cohorts of orthopedic surgeons and the burnout rates and there. So just showing the high rates, emotional exhaustion, depersonalization, and low personal accomplishment, even though, in a field where everyone is extremely accomplished just to get to where you are, people have that feeling of not feeling accomplished. So why orthopedic surgeons? Why are, and this applies to neurosurgeons as well, so spine surgeons in general, because taking the path to get there is kind of roughly the same, but we strive for excellence, and orthopedic surgeons define their identity a lot of times in their perfection and efficiency at all costs. And we've, as Dr. Mundis kind of talked about this weekend, we are taught habits throughout our training and residency, and we're taught to be tough and push through challenges without regard for our own or our colleagues' own mental, emotional, or physical fatigue. And we just are trained in this way, and it's just ingrained in us, and we can't change that. And so our perfectionism pushes us to improve, and it creates a culture that, it a lot of times leaves no room for error, no space for grace when a mistake is made. So when we do make mistakes or we do feel inadequate, it takes a big toll on us as surgeons. And then these qualities dehumanize the experience of being an orthopedic surgeon. We lose sight of why we became a physician and why our ultimate goal was and what our values are. And so it's very difficult to keep these qualities when you're just trained and learning to push through all these things. And then these unrealistic expectations create this atmosphere that makes us that we don't want to be vulnerable or support one another when we need it most. We're scared to talk to our peers. We're scared to talk to our partners or our mentors, because we don't want them to perceive us as being weak or perceive that we're not a good surgeon, even though that's, every surgeon's gonna make mistakes. So and then another factor is that orthopedic surgeons and residents, work hour wise, we work a lot. So increased burnout in some studies showed that the orthopedic residents who work more than 80 hours per week had increased burnout. And then if you're using the electronic medical record for more than 20 hours per week, you have increased burnout. And so, sometimes it's difficult to avoid working long hours, or difficult to avoid being on the computer or the EHR for that long, but it happens. And we have to figure out ways to cope with that and deal with that. This is kind of looking at the burnout inventory scale, and this is attendings in the gray, fellows in the dark gray, and in the black, the residents. And the workload in this study of orthopedic surgeons was the biggest factor, but you can see all of these are kind of different areas that we'll talk about as we go on. And then nowadays, we talked about some of the factors, but there's even more things. So patient satisfaction scores. We talked a lot about that this weekend, ways to attach value and things to physicians and how they're doing, but what is the effect of that on physicians? And this was looking at physicians. They felt pressure to emphasize patient satisfaction scores, but out of this, 63 out of 107 surgeons reported PSS having a negative effect on job satisfaction. 31 out of the 107 considered leaving their jobs or career due to these patient satisfaction scores. And then 84 out of 107 report that these scores and looking at these report to their burnout. So although these are important factors for us to look at, it is also coming at a cost to physicians and those training and those treating these patients. So, and then specifically in the study, a cohort of physicians treating patients with spine pain, the PSS scores are associated with decreased job satisfaction and increased burnout. And ultimately that's our field, and that's what we're treating with. So, and we know it's a difficult problem, and so that's something we'll have to attack, and we'll talk about that as we get into how we respond to these things. Health and wellness practice. So these are looking at different medical fields and how they kind of attack their own health and wellness. And so within the spine field, there's only 13 respondents, but only about 38%, about 40% were compliant with CDC aerobic exercise kind of recommendations. And then 3 out of those 13 had not seen a primary care provider within the past 2 years. And then dentists, these are just basic things, but, little things, but they start this downward cycle. And so last cholesterol check, greater than 5 years, one of them, and then screening for some of these patients, we were able to do those, but, regardless, those are all important little things that we don't look into or we forget when we're so stressed out with work. And then complications and the second victim, throughout work, you're going to have complications. And we've talked about this at Journal Club, and the sense of anxiety, guilt, sadness, embarrassment, and anger that comes along with these. And so 60% of respondents in this study that were orthopedic surgeons said it was difficult to handle the emotional effects of complications in their career, and that even with greater experience as they moved on, they had no improvement in how to dealing with these. And then those reporting the errors had significant greater levels of measures of burnout on mental quality of life scales that were done within this study as well. So these include things like emotional exhaustion, depersonalization, decreased personal accomplishment, and symptoms of depression, all those kind of same things we talked about at the beginning that fall into the different categories of burnout. So this is just another factor that comes with our field that we have to attack head on. And then kind of one more thing to pile on is litigation. Nearly 15% of orthopedic surgeons face malpractice claim annually. By the age of 65, about 99% will be involved in a malpractice lawsuit. And nowadays, fear of litigation is very common, and this changes physician behaviors. And so they estimated in the study that physicians are ordering non-educated and redundant tests to avoid high-risk patients and avoiding high-risk patients. So this contributes to systemic costs. The annual cost of a defensive medicine and orthopedic surgery alone has been estimated at $2 billion. So, once kind of this fear and this kind of leads to changes in our habits, even though we know maybe it's not necessary, we're doing these things to avoid these problems because we are scared of the outcomes and the potential kind of downfall of that. So, and then burnout improves in the long-term period after a lawsuit settled. So in the short term, it can cause things. And so, being able to move on past that's very important. So now we've kind of talked about different factors that lead to it, but now, it's important to talk about how to overcome burnout. And so this is just a general kind of table overlooking all that, and we'll kind of talk about these specifically, but mindfulness-based interventions, counseling sessions and workshops, maximizing protective factors, and then institutional adjustments. We talked a lot about these things this past weekend, which was really good, and that's why I think some of that conference this weekend was great for us, but we'll kind of talk some of the research into some of these things. This is just another table kind of talking about the same thing. So a lot of these are the same. So when you look at these papers repeatedly, they stress the same things. And so we'll talk about that. So family, these aren't in any specific order, but, I did kind of think that some are probably more important than others. And family is important. If you spend an average of 90 more minutes each day awake with your partner and involved in talking to them, it's very good for your mental health, and also helps decrease burnout rates. And research suggests that physicians that compromise the quality of their family life when they choose to add absences due to non-work related activities, these increase the rates of burnout. You should engage your partner in meaningful discussions regarding your reactions to your work experiences. So this is a little bit different than what the next bullet point is talking about with passion killers, which is a physician who drones on and on about technical and medical details, which your partner might have little or no interest or not understand. This is more talking about your emotions, your feelings, and your work experiences, and so that you and your partner can help develop as a couple, and that your partner can help you develop as a person. And then you have to honor your spouse's role. So each member in a successful marriage voices or relationship voices appreciation for pride, their contributions that their spouse brings to their collective life. And so, our spouses, our partners, your friends, your family, they have an important role of all this, and you can't overlook that, because that comes at a cost. If you're burnt out and you're not acknowledging that or trying to engage with them, that leads to bad repercussions like we discussed earlier. And then you can't forget to play, whether that's with your family, your kids. This clinical experience suggests that family members and surgeons see them as rushed, fatigued, worried, and focused on performance. And so you have to be able to disconnect, and we'll talk about ways to do that. But you can't forget to play. When you read a lot of these articles, it's a very simple concept, but it's something that even myself this year and through residency, it's hard sometimes, but you have to do it. And so family reads right into value, and finding meaning in work has been shown to be an important wellness strategy. You have to have these goals. We had read a book with Dr. Mundis that he talked about this past weekend as well. And your values are what's important, and you have to understand what's at the center of all this. And family is at the center of this a lot of times. And so you have to, but you have to understand this meaning so you can do that. And then within work itself, you have to find the things that make you feel valuable and make you feel that sense of value. And so physicians who spend less than 20% of their time on the aspect of the job that they find the most meaningful has significantly higher risk of burnout. So just for example, this would be someone who values education. Just, even if you're in a private practice setting, you can spend 1 day per week working with trainees, and this can lead to increased job satisfaction and help avoid that burnout. And then you have to remember intrinsic motivating factors. Money and success and awards are one thing, but the intrinsic motivators play a larger role in career and life satisfaction compared with those external motivators. So you have to have that commitment to patient care, commitment to the practice of medicine, and overall life meaning and value. And that's, like I said, what you determine is that. And so, family or something of those sorts should be at the center of that a lot of the time. You should, early on when you're starting your career, develop a personal philosophy. Once you determine what does motivate you, and you should always keep that in mind, because ultimately when you make decisions, they should come based on what you determine as your personal philosophy, and that leads to a greater sense of control and meaning in life. When you have those values and you don't stray from them, then you feel like you're making the right decisions and you're making them for the right reasons. And then self-awareness, which is another topic we'll talk about, is a way to help identify this meaning in work. It's not easy to always understand why you're doing things or what motivates you, but self-reflection and journaling is key to that. And then small group discussions that you talk about difficult traumatic situations without judgment are also another way to help you kind of foster that. Positive social relationships. When physicians have a close relationship at home and at work, so whether that's with your spouse or your partners at work, this allows you to share your feelings and overall helps you become a happier person and avoid burnout. Groups that meet regularly to share emotional and humanistic aspects of the profession help increase the self-awareness and develop these positive relationships. These are some examples of different types of groups that you can look into with or like type of round, like M&M. They're not M&M per se, but different groups that you can go and look into if you're looking for something like this that help with this. And then you have to set clear boundaries in your career. If there's anything I've learned this year from working with everyone here, it's you have to set aside time and understand that the importance of that. So you set aside time on your calendar to spend quality time with your significant other, with your children or your friends. You need to disconnect from electronic devices during this time to allow for quality time. It's about quality time, and that's what's important. It's if you're at home and you're playing with your kids, but you're sitting there on your iPad or your phone the whole time or your laptop, that's not really actually disconnecting. You're not really doing yourself any services there. And then once we kind of already noted earlier, if you set time aside for these kind of meaningful relationships, this makes you happier. This helps avoid burnout. We talked a lot about, and Dr. Mendes touched on it, but this weekend, and so did some of the other physicians, but exercising is vital to mitigating stress and decrease the rate of burnout. Physicians who use exercise as a coping strategy outside of work showed a significant amount of decrease in emotional exhaustion on these studies and overall decrease in burnout rates. And this is simple. We talked about zone 2 training and how easy that is, but even easier than that, there's CDC recommendations of 30 minutes of moderate intensity aerobic exercise, which is essentially a brisk walk per day. These physicians had improved quality of life in various studies and these meta-analyses. And so this is as simple as breaking up exercise into 10-minute bursts 3 times per day, and that can improve your health. And so it's hard to set aside time as a physician and really commit to that, but it's small and simple tasks like this that can really help in the long run. Here's a table that in one of the analyses that kind of helped bring together the different types of ways to practice mental wellness and mindfulness. And so I think some of the things we talked about this weekend, I think Insight Timer was the one that one of the participants in the conference talked about, the app on your phone, but there's all kinds of apps. And then there's mindfulness practices, journaling, retreats, exercise routines, hiking, walking. It doesn't have to be as kind of intense as you'd think. These are very simple concepts. So with journaling, why is this good? It allows you to combat stress, face failure and traumatic events, and improve communication and writing skills. And it doesn't have to be, not everyone's going to do this the same way. You choose a medium that fits you best. Sometimes that's a little bit of writing and drawing. Sometimes it's writing, just little notes down. Sometimes it's writing in paragraph form. But just any type of writing helps you kind of release and understand things. You have to make time for it. You have to write regularly, and then you have to kind of let the topic choose you. You don't want to force yourself into topics. Some days you're going to want to write about something random. Other days it's going to be about a very serious thing that happened at work. But it's important to let your kind of emotions and your mind kind of release when you're doing this, and then you can choose your audience, however you like it, whether that journal is just for you or that journal is to go talk within a group, but you choose that audience. Another part of wellness is sleep. The less sleep you get, like we talked about this weekend, is it like a badge of honor in residency when you're talking about, I don't need to sleep that much, and is it, perceive yourself as like cool or better than people? Yeah, it is something that people kind of talked about, and even myself, like I still don't sleep that much, but it's extremely important for avoiding burnout, but also medical errors and making sure you're treating your patients well. And so one night sleep deprivation, and Dr. Mendes touched on this weekend, but results in 60% greater amygdala activation in response to adverse imagery. And so it's not every night is important, and it's not easy to set aside or do this every night, but it's vital to making sure you avoid medical errors and avoid burnout. And that's what a lot of studies have shown. And so how do you do this? You come up with a sleep routine, schedule resting time and make it a priority, develop a consistent bedtime routine, don't drink alcohol within 3 hours of sleep. It's been shown to interfere with sleeping. Only get in bed when you're ready to sleep. Purge your worries and get to tomorrow's to-dos off your chest by journaling, like we talked about earlier, before you try to sleep, and then you do a wind down, and then you keep your sleep schedule consistent. This helps you keep on that task and avoid missing those nights of sleep if you have a set kind of schedule, which it's hard, with kids and wives and commitments and travel, but and husbands, like you got to deal with a bunch of things in life in general, but you have to try to do that. Now we're going to talk more from where we shift from personal things that you can kind of deal with to more work environment. And so a lot of studies now have shifted their focus to organizational intervention, maybe more productive than individual interventions. These are things like workload, autonomy, recognition, community, fairness, meaning in work. Those things all stem not only from yourself, but also your work environment that you're in. We constantly, whether you're just starting or you've been in practice for a while, you have to work with this administrators and reassess the work environment and make adjustments as needed to maintain a healthy work environment. And so, there's certain parts of your work environment that you control. There's certain parts you can't. Something I've learned this year is that when next year, or like I guess not next year, in a few weeks, when I'm in charge of my own schedule, clinic is something that I can control. It's something that I can kind of schedule and make sure it fits my values and what I want out of my workday and out of my life. And so that's something that you can control. And you know another factor that you control is how to say no. We talked about that a lot this weekend, and when you look at a lot of these articles, they talk about learning how to say no. And that's extremely important, because you have to say no sometimes, and that goes back to kind of those initial things where you have to set your values and your priorities and understand that, and that should shape your decisions, not the pressure of publishing another article. You have to keep all that stuff in line and in sight. So mental health and therapy. We don't like to talk about, or as physicians, we don't like to talk in general about any weaknesses, and we don't want to. Therapy is almost taboo, but we're stigmatized by colleagues if we seek out mental health care, is what we think a lot of times. But most large organizations do have some assistance programs. But when you do surveys of physicians, they're concerned about doing any of this because they're concerned about loss of confidentiality, negative effects on licensure, and risk of losing staffing privileges and potential barriers to. So these are potential barriers to seeking out that help, because physicians are scared. There was a survey, so a third of states have medical licensure application questions specifically concerning mental health disorders, and 40% of physicians were reluctant to seek formal medical care for treatment of mental health conditions because they were concerned about medical licensure repercussions. So people don't want to treat themselves, and they set themselves down a worse path because they're afraid about their medical license, when in reality the bigger issue is if you start going down that path and you don't get any help. But there's always that thought hanging over our head as physicians. And so professional coaching and counseling. In this study, the study looked at, this was at residents, but it was orthopedic residents. They were set up with counseling services and programs, and they were pre-scheduled with the counselor, and then they could opt in and out. And 96% of the residents felt that counseling was helpful. And then before the program, 73% of the residents had never used counseling professional support, but after, 79% said they would now continue to seek counseling when needed in the future. And after the study, 86% requested their residency program to continue scheduling wellness visits for them. So when you take that stigma away from it and you make it more kind of widespread amongst the group, whether that be residents or physicians in a hospital, people will take advantage of it and want that help. And then something we talked about this weekend and had a quick snippet of is professional coaching. Professional athletes and top performing CEOs work one-on-one with coaches on a regular basis to become the best in their field. So why don't surgeons do that? Shouldn't surgeons work one-on-one with coaches to improve their ability to take care of patients, become a better leader, deal with stress, and implement wellness practices? When you look at studies of physicians who have done this in surgeons, they report positive effect on boundary setting, prioritization, self-compassion, self-care, and self-awareness. And then a recent study from the Mayo Clinic demonstrates that coaching can have a positive impact on surgeons, including surgical outcomes, patient safety, and well-being. So this goes beyond just helping you as a person, but and these aren't necessarily coaches that are coaching you in surgery. These are just coaches that are teaching you these tactics on how to deal with life and work stresses, and how to set your priorities, and that makes you a better surgeon a lot of times, because you can focus on that and you don't have a lot of those other stresses. So this is just kind of how you go about this, and essentially you have this improvement cycle, so reflection, goal setting, and intentional adjustments, and sometimes you just need someone else to set you on that path and help you with that. And this was just that Mayo study, and how they initiate a surgeon coaching relationship and then establishing a surgeon coaching program. And so this can be from your mentors, or this can be from outside people. And then now, as the kind of stigma of, we saw that how the articles have shifted over time, and how there's all this stuff about burnout, and now the new kind of, or one of the topics that is talked about, is resilience. Resilience is the ability to return to a baseline after stressful events, and even grow or develop as a result of facing challenges. So this is important. How did you develop resilience? And a lot of those things we just talked about help you develop this resilience, and because they help increase your capacities, both psychosocial and personal capacities to deal with these things. And then when you are able to build up these things and deal with these, you activate positive emotions and build greater resilience. And so that's ultimately the goal of this. And there's other ways to do this. Supportive professional relationships help cope with work stress, decrease the risk of burnout, and so this helps with resilience overall within a group. And then the ability to tolerate uncertainty and ambiguity was a significant contributor to work satisfaction and resilience among healthcare providers. So having these coping mechanisms helps you tolerate better and develop this resilience, because the thing is you're gonna have work isn't going to be perfect all the time. You're going to have these complications. You're going to have difficult patients, but resilient physicians that have these coping mechanisms, you're able to deliberately deal with these and understand your own limitations, and learn from these mistakes and move on from these mistakes. And so that's why all these things are important, because if you're not able to do that, then you can't really move on. And so that's where I think that the difference between wellness and resilience, because wellness, there's a lot of factors that can lead to wellness, but ultimately you have to have this resilience that helps you move on. And so, because adversity is inherent in life, and like I just said, and within medical education and practice, there's going to be adversity. And so I think the difference between these two, when you're looking at these, is that resilience acknowledges that adversity exists, whereas wellness sometimes looks at everything with such a happy light that, oh, if you sleep more, this and that. But you have to acknowledge that there is some things that you can't control in adversity, and so that's why resilience is important too. And so and then you have to look at this as a whole. Resilience doesn't just come from the physician themselves, but also the organization. You need organizational resilience. So the bond between the individual and the organization, that is the weakest link or the issue, and that leads to the breakdown. And so there has to be a connection between the two, and that's kind of what this image here shows. You're going to have stressors on both sides, but the two sides have to work together to kind of deal with this, because when you look at this from a top-down approach, the physician would be here at the very bottom of the triangle, but all these stresses at the end of the day, sometimes the physician feels fall on them, from the institutional level, professional assistance level, and then ultimately your own kind of vulnerability as a physician. But when stuff happens, there's a lot of people involved, but ultimately the physician is the one that takes the brunt of this. So how do we deal with this? And sometimes it has to be a health systems change, not just a physician change. We can try as much as we want to do those things that I said, and you're still going to be frustrated. You're still going to have issues. And so this was a crew resource management. This was looking at a study that they used this system developed within the aviation industry to training leadership, staff, and providers, and incorporating customized safety tools to generate cultural change and leveraging patient safety. So they really focus on engagement and readiness of teams, staff and patient satisfaction, and safety, event and culture safety, climate data. And so we're not going to get too much into the details, but they forced all people. So this was senior leadership, including board members, including nursing, including the physicians, to all attend this same standardized training for this. And then they did 8-week program with 1 hour per week of mindfulness training that helped within all these groups with things such as yoga, mindfulness training, music, nutrition, and self-assessment. So just basic things that we just talked about. And they looked at the effects of this over 3 years. And conservatively in this study, they estimated that the return on investment, based on how much they paid for the training versus the amount and decrease of the safety events or negative events that had happened in the hospital or medical errors, was about $9 million across those 3 years, just from some basic training, 8-week program, and getting everyone involved, not just focusing on the physician. This is another one within at Ortho Carolina, where they focused on cultural wellness in their own orthopedic group. And one of the main things that I took away from this article was the corner 4, the kind of how you relationships are kind of formed, and what they wanted to get through was corner four, which is this true connection. And when you get to that corner four, it's a relationship where there's the physician feels that they could share an event, receive honest feedback with empathy in a safe and nurturing environment. And these corner four conversations allow physicians to metabolize and kind of better work together to do these. And so you're then asking questions from a place of curiosity as opposed to judgment, and then you're kind of how we did with some of the discussions this weekend, but you're concluding the conversations by expressing appreciation for the physician and mutual learning. So you're not attacking. This isn't an M&M forum where everyone's attacking someone, but rather you're forming true connections. And so they found that within their group, satisfaction and burnout rates were decreased when they were able to focus on everyone working together as a team and then having that true connection. Other tips and tricks and things that we talk about: management of difficult patients. You have to realize that when you look at studies, only about 10% of patients are difficult. So just understand that as much as they take up your time and your day and your thoughts, that it's only about 10%. And so you have to know why those patients are difficult for you and know how to adapt your behaviors for those. Recapturing the purpose and values of your profession. Participate in things such as humanitarian missions. This allows you to detach yourself from material requirements and move freely to practice medicine. As I stressed earlier, you got to anchor yourself in your personal values, and then you have to know how to communicate and express ourselves, which is difficult sometimes for us. Personal experience on this, my GSO trip this year, this was a huge, I've done a lot this year, but that trip was probably the most fulfilling thing I've done, in my medical training. It teaches you basic things, less resources, more autonomy. It forces you to think in a totally different way than you ever do. And so it gets those creative juices flowing again that you can sometimes lose sight of. You realize the impact you have on your community. When you're doing the day-to-day job here, you a lot of times lose sight of that you're helping people actually, because you're dealing with that difficult patient, you're dealing with those complications. But this going on trips like this can help dissipate the feeling that one is expendable, and then it helps you kind of reorient and realize that patients are the priority. Recent studies show that orthopedic surgeons spend about 50% of time on paperwork and less than 30% time on patient care. But when you go on these trips, it's all patient care. You really get to develop those relationships again. And I can remember almost every single patient interaction I had there. And I can't say the same for here. And so these are, and everyone fills their cup differently. And so medical mission trips aren't for everyone, but that's why you have to find what you find valuable. And, and this is just an example of a case we did. We won't spend too much time on it, but, creative thinking that we did. And I'll keep moving for the sake of time. And then even basic things, ergonomics and spine, making sure that you can last, because this contributes to burnout too. If you're struggling physically, you're not going to be able to sustain a long career. And so 36% of injured surgeons report that performance in the operating room was at least minimally impacted by an occupational injury. These are things such as cervical spine disease, rotator cuff, carpal tunnel. We spend so much time with our loops on and looking down, and that's not good for you. And so how do you go about this? And so and other things, radiation exposure, those are all important things. And like I said, as you delve deeper and deeper into this, these are all factors that contribute to how you do, how it affects you as a physician with burnout. And so ergonomics and training. So, they have pneumatic Kersons if you need that, bone scalpels, optimizing operating table height, things like that. And then new studies look at taking micro breaks during surgery, 1.5 to 2 minutes. It's hard when you're got a long surgical day to want to take a break, but these in this study they had 1.5 to 2 minute breaks every 20 to 40 minutes, and an improved self-reported physical performance, mental focus, body part discomfort, and 80% of patients involved 87% of surgeons involved wanted to incorporate these breaks into their routine practice. And then even when you're using the microscope specifically, 30-second micro breaks every 5 to 10 minutes increases the time to onset of neck and upper shoulder pain that we all get when we're standing under the microscope for a super long case, and reduce overall surface EMG muscle activation. So it's important to, these are little things that contribute to the overall big picture. And so, the difference between using loops all the time or using a microscope, look at the neck angle here and here, and then using protective equipment. And then another thing, how to fill your cup, and something that, I've seen firsthand with the mentors that me and Amber have been lucky enough to have this year is when you act as a positive role model for other spine surgeons, you have an opportunity to create a culture of mentoring that is rewarding not only for them, but also for you. And it leaves a legacy of mentoring that affects future generations. And so successful mentors can experience feelings of pride and joy, knowing that they've had a hand helping their mentee reach their personal and professional goals. And so that's another way that, you can go about this. Like I said, everyone fills their cup differently. You need to realize your values and go about that. But ultimately, the goal of all this is, we all talk about success as a surgeon, but ultimately for me, I think happiness is what we want. And happiness is when what you think, what you say, what you do are in harmony. And I saw a prime example of that with Dr. Mundus, and when we were on a GSO trip, the smile on his face was like that almost the entire trip, except for whenever there was a frog at dinner making loud noises the whole time. But the rest of the trip, he had a smile on his face like that the whole time, and so did I, because it's hard not to. And so everyone's different, and so you have to understand those goals and learn from your mentors. And Dr. Eslack with his daughter's softball. I mean, I don't know how he does it, but he's set that as a priority in his family value, and you realize that. And and then just the way that you guys have dealt with me and Amber this year, and helping us realize these things and prioritize these. I'd say it's the first time in my training that I really felt that my mentors cared about those things. And so it was really although it's a difficult year, it was an eye-opening year, but it helped me realize the importance of all this. And feeling that I could actually talk to my mentors, and that's really important. So, and then having people around you that you can talk to is not only your mentors, but your peers. I've had Amber by my side this whole year, and I've been extremely lucky. I couldn't ask for a better co-fellow. I know she said that about me, but I think that it's more true when I say that about her, because she's amazing, and I don't know how she does everything she does, but she's helped me, and everyone else here has helped me be happy and allow me to be happy. And so when you're happy at home, you can keep your kids happy and your wife happy, and you keep your values in line. So that's kind of summing everything up, and smile on my kids' faces. That's what we all want at the end of the day, and for ourselves. And so it was a great year, and feel really lucky to have kind of learned a lot about spine, but learned a lot more about myself this year. So
thanks, Cam.
Yeah, that was awesome.
Awesome talk, Cam.
So, so what are you going to do next year? Like, obviously you went through a ton of different things, and like one of the challenges is like, okay, like type A people are going to be like, okay, for me to be happy, I have to do this, and this, right? I gotta get all this all right. Otherwise I'm not going to be happy, and that's our unfortunate tendency, is to like make happiness a chore. And then all of a sudden it's like at the reverse effect, right? Like, because then you fail at some of those things, and then you say, okay, I'm a failure. Like, and so instead of these incremental benefits that you should get from all these different activities, like you end up doing the exact opposite, right?
Yeah.
I experienced a little bit of some of that in my life, because like even the whole GSO thing I went too deep into it, and then it hurt, right? It didn't help. It actually became a burden instead of it being a true joy, right? And so you have to, I guess my question to you and to Amber would be, and eventually obviously Ryan too, is like, what are you going to do? Like, what are the first steps that you're going to take in your practice that are going to maybe help you inch toward, this burnout prevention, or towards happiness?
Yeah. No, I mean, I think one of the first things is like you've taught this and kind of really echoed this throughout the years, like control over my clinic. I can set those days. My clinic days is the days where I can take the kids to school and pick them up from school. I can set that schedule. That's like something I do have control over. Whereas, before I'm so used to like, oh, I should start clinic as early as I can and go as late as I can. Now I realize that maybe that's not as important. And if I see a few less patients, but I can take my kids to school and spend more time with my family, that's important. And then developing my staff early on and the people around me to kind of help me meet these goals. And I'm not good at offloading work, and and I'm sure Amber would say the same thing. We both like work, and we'll take the burden of work on our shoulders a lot of times when we shouldn't. And so I think, and it's going to be hard, but work on letting other people do their jobs, I guess, when, and setting those boundaries and setting those kind of expectations for them that kind of take some of that off of my plate. And then, something else we talked about is, therapy, having someone to talk to. I would have never considered that. If you asked me a year ago, I would have had that same kind of thought process or stigma that, I talked about with orthopedic surgeons and surgeons as a whole of like, no, I don't need that. Like, why would I ever do that? But like, whether that's coaching or something else, like that's going to be one of the first things I think I'll seek out, because I think that it's vital to kind of help. And early on, I trust me, it's, I'm already thinking about, my first day of work and my first case and stressing about it. So like having someone to talk to, which, family and Carla and my, family, friends, things like that is one thing, but just having someone outside of that is, I think, is huge. It's something I've learned this year. And so that's going to be, those are kind of some of the first things I want to initiate early on.
Good. We'll hold you to them. Just to make a few comments about what the things you said, I think they're actually really important. One is focus, right? The more successful you are, the less you do. That's the way it should be, right? Because what's happening is you're empowering people around you. And what you don't realize is by empowering people around you, you're actually contributing to their happiness, right? If you let other people do the things that they're good at, you're actually giving them meaning in their own lives. If you take that away from them, you're actually contributing to the negative effect on a team. So allowing someone to be good at something and living within that space, I think is really, really important from a team building and leadership standpoint. So I think what you're talking about, I think is important. And you'll find things, okay, these are things I have to give up early on, but these are things I have to maintain control over until I figure it out myself and I can pass it on. So, keep an inventory of that. And then the second thing on the therapy side, I think it's really important, Cam. Like, we don't talk about it that much, but like if you can understand your compensatory mechanisms, if you can understand how you think better, then when the emotions arise within you around difficult cases or complications or dealing with your family, like you'll be able to manage that. And the thing about burnout is once you're burned out, you're screwed. Like you're off the cliff, right? And so you have to climb back. Up after you burn out, like it's like you don't see many people being able to do that. I mean, people take long sabbaticals, people go away from medicine altogether, like don't come back. Like, so one of the difficult things is that I think as physicians, especially orthopedic spine surgeons, neurosurgeons, we like to go right to the edge of that cliff and see just how close we can get to it, right? And the reality is that, so much of what we're supposed to do is actually on the prevention side of things. And so, having a mindset where you're trying to stay as far away from the edge of the cliff as possible, because that's a lot safer, I think is how therapy works. Like it keeps you away from the cliff and actually lets you take what would seem to be a really difficult hike and makes it a lot easier. And so I encourage it. I think it's a great step to take. I wish there was more institutional inertia around promoting that, even with like in our division or our orthopedic group. I think it could be really helpful for us. Anyways, I guess like wonderful talk, Cam. Thank you for being insightful and open to talk about these things. Like it's a blessing to have you this year.
Thank you. Blessing to have all you guys.
Yeah, I agree. Yeah.
Love you, Cam.
Hey guys, I'm gonna make a point too about as you go forward with the struggle that we all have is as orthopedic surgeons and as high functioning human beings, when we admit our vulnerabilities. I think we all struggle with that. I think it's hard to bring those forward. I think we all try to internalize those. And I think it's one of those things where you can really feel a lot better when you're able to do that, because what it does is it opens up other people to be able to provide you assistance and help in the process of struggling with what you're doing every day. Because we all try and do it on our own. We're all taught that we don't want to admit those because it makes us seem weak or incapable. But in fact, think about the last time that someone's come to you with a vulnerability that you looked at them as somehow weak or incapable. So in fact, what we think is a sign of weakness is actually a sign of strength, and we just don't see it that way. So as you go forward, don't internalize this stuff. Don't internalize that complication. Don't internalize that bad interaction. Don't internalize something that is creating a whole lot of stress. Go ahead and admit it and bring it out, bring it to somebody that's safe that you can share it with. And then, getting it out is so helpful, so therapeutic. And then it allows you to move forward to a better place to be able to resolve and move forward from the problem that you may be having. We burn out when we get stuck there, when we can't do that.
Great point.
And I don't know if anybody noted, but Dr. Mundus has the day starting out right mentality. He's got the coffee roaster sign in the background. He's outside. Yeah.
He's good, man. I'm just glad people are getting into this like at the beginning of their careers as opposed to like 5-10 years into it, like when they're already kind of struggling, to kind of start with this being salient to you and salient to Amber is, I think, a really good thing.
Yeah, I mean, Amber, you asked a great question. Like, I'm supposed to deal with these robots versus, with different aids that help with surgery. And, I actually thought Dr. A, when he got up, I actually thought he was going to say something he always says to me, which is, it's not about the widget. It's about the basics of surgery, right? Like, so the basics of, if we teach surgery well, then you'll be able to adapt to a robot or navigation or, different pathologies or whatever new technology comes out, because Lord knows in 10 years, we're going to be doing things differently than we are now. So the basics of spine surgery, I think, are the most critical thing in your fellowship as you're learning technically. But this is like the same sort of process, which I think hopefully this year turns into more as we develop our program, is like the basics of life and lifestyle, that will promote a better career for you, and I think these are critical conversations that we honestly probably should be building into our journal clubs and even into our our conference schedule a little bit, we weave it into there a little bit better so that we're having these discussions, even if it's just passively in clinic and with your mentors and people that you're connecting with even throughout the year. So I think it's timely, it's good, and ultimately I think our success as a fellowship is going to be whether people are, living wholesome lives and, their marriages are healthy and those kind of things. I think those are for sure the metrics that I think matter most, not whether you know how to use a widget or how fast you can do a decompression or those other things that are sort of salient and irrelevant relative to the greater aspects of life. So